Sickle cell anemia. Misty Berg. Damien, a 19-year-old African-American male, reports to the clinic for acute generalized bone pain. He reports stress from schoolwork. He has no respiratory symptoms or neurologic changes or fever. He has had no previous admissions to the hospital. On physical exam, there were no causes for pain, signs of infection, hypoxia, or respiratory disease. This patient did not want to be placed in the hospital for treatment and wanted to manage the crisis at home. Sickle cell disease is an inherited autosomal recessive disorder that is expressed in sickle cell anemia, sickle cell thalassemia, or sickle cell HBC disease. Sickle cell anemia is a homozygous form. It is the most severe form of sickle cell disease. Sickle trait cells will begin to sickle at about 40 millimeters of mercury. Hemoglobin S that is not bound with oxygen forms aggregates of semisolid gel that become stacked within the erythrocyte, stretching it into an elongated crescent. This is a representation of normal red blood cells and sickled red blood cells. Sickled erythrocytes tend to plug blood vessels, causing vascular occlusion, pain, and organ infarction. Most sickled erythrocytes regain a normal shape after reoxygenation and rehydration. Any organ system can be affected, including bones, spleen, liver, brain, lungs, kidneys, and joints. Again, another representation of how a normal red blood cell passes through the vessels and what a sickled cell looks like passing through the vessels. Sickling is an occasional intermittent phenomenon that can be triggered or sustained by the following stressors: decreased oxygen tension of the blood, increased hydrogen ion concentration in the blood, increased plasma osmolality, decreased plasma volume, and low temperature. Treatment includes supportive care aimed at preventing consequences of anemia and avoiding crisis, aggressive management of fever, early diagnosis of acute chest syndrome, red blood cell transfusions, and proper pain management. Avoiding fever, infection, acidosis, dehydration, constricting clothing, and exposure to cold. IV fluids, antibiotics, genetic counseling, and psychological support for the child and family, bone marrow or stem cell transplants, or splenectomy. Bone marrow or stem cell transplant can cure sickle cell anemia, but is not an option for most children because it is often difficult to find well-matched stem cell donors. Genetic counseling is important for people with sickle cell disease or trait to make informed decisions about passing on the genetic disorder to their offspring. There is a 25% chance with each pregnancy that a child born to two parents with sickle trait will have sickle cell disease. Sickle cell tends to occur in people with origins in equatorial countries, particularly Central Africa, the Near East, the Mediterranean, and parts of India. Sickle cell traits occur among about 1 in 12 blacks and 1 in 100 Hispanic Americans. All the states in the U.S. have included newborn screenings for sickle cell disease since 2005. Sickle cell is a lifelong chronic condition. Sickle cell trait may provide protection against lethal forms of malaria, a genetic advantage to carriers who reside in endemic regions for malaria, including the Mediterranean and African zones, but have no advantage to carriers living in the United States. Laboratory features include normocytic anemia, sickle cells, nucleated red blood cells, target cells, and other abnormal red blood cells on peripheral blood smear. Presence of hemoglobin S on a hemoglobin assay. Clinical manifestations include pallor, fatigue, jaundice, irritability, and pain. Extensive sickling can precipitate 4 types: vaso-occlusive crisis, aplastic crisis, sequestration crisis, and hyperhemolytic crisis. Vaso-occlusive crisis begins with sickling in the microcirculation. Aplastic crisis is a transient cessation in red blood cell production resulting in acute anemia occurs as a result of viral infection. Sequestration crisis is when large amounts of blood become pooled in the liver and spleen. Hyperhemolytic crisis is an accelerated rate of red blood cell destruction. It is unusual but may occur in association with certain drugs or infections. This patient was given hydromorphone along with ibuprofen and acetaminophen for pain. An opioid contract was put into place, rest, adequate fluids, and a hematology referral. This was the patient's first crisis, and he was referred to hematology for further evaluation. He did well at home with his first crisis.